All right, we are live. All right, it is 11 o'clock. I'm not gonna waste too much time. We have a good live today, especially for this community. And I have a special guest, Dr. Jess Weidman, who is a board certified veterinary cardiologist. We're going to talk about some heart health, some good questions, and some great things about how we can move forward with this breed. And then at the end of that, we're going to open it up to questions. So while we are going through this, I'm going to say please hold off on the questions until the time. I don't want to overlook anybody. So thank y'all for tapping in and good morning. But in the meantime, drop comments. Let me know where you're from, what class of American Bully you breed, and we're going to get this thing underway. Do me a favor. I see we got some people coming in. If you don't mind sharing and tagging whoever you think should see this. Also, let me have a few reactions, some likes, some hearts, send them up, please. It's free to you, but it is very valuable for me. If you can send reactions up, it helps the algorithm, gets that out there for more people to see. So please like, share. And we are going to bring Dr. Jess Weidman in again. People, I appreciate y'all for tapping in today. And it's going to be a good one. So we're going to get into it.
That pet talk, it's that pet talk, it's that pet talk.
Okay, Dr. Jess Weidman, how are you today?
Doing well. Thanks for having me.
Thank you for taking the time out of your busy schedule to do this for us in the middle of your work day. So if you'd like to introduce yourself and let people know how they can get in contact with you, please do so.
Sure. My name is Jess Weidman. I'm a veterinary cardiologist. I work, let's see if you guys can see this. I'll hold this up for a second. This is my company, Blue Ridge Veterinary Cardiology. Based out of Charlottesville. But I do travel as well, to dog shows and health clinics and things like that. All right, so probably the best way to find me is just look up Blue Ridge Veterinary Cardiology, and there'll be links to the email there. You can just send me an email.
All right, thank you. So we're not going to take too much time. We're going to get right into it because I know you're busy. So the first question that I want to ask today is for those who don't know, what is it that you do and how is that different from me going to get a regular vet checkup?
Sure. So A veterinary cardiologist has done extra training after veterinary school. On the veterinary side, we have just about every specialty like they do on the human side, surgery, internal medicine, cardiology. And so the way it would work is you finish veterinary school, then you do a 1-year kind of rotating internship where you get exposed to everything again. And then after that is when you would choose to specialize. So for me, I went on and did a cardiology residency. That's 3 years where all you're doing is cardiology. You've got other cardiologists watching you and teaching you, and you've got the opportunity to ask them questions. And then along the way, you take a couple exams. You take an exam after your 2nd year, and you take your final exam after your 3rd year. So after you finish all that, if you pass your exam, then you're a board certified cardiologist. And so, we're really focused. All we do is the heart stuff. So that gives us, the opportunity to get really good at it. And you just really focus on one thing and be experts in that area.
So you have some people who say, well, when I get my puppies checked up, they do that for me anyway. What do you say to that?
Like just at the primary vet, you mean? Or
yes. And they say, hey, I got my puppies checked up before I sold them to the customers. The vet never told me anything was wrong with the dogs. What's the difference?
Yeah, so the first step is just kind of listening to the dogs, and that is something that primary vets do all the time. That said, for things that are kind of mild or subtle, a cardiologist is going to be better at picking up those real mild things, or just having more of an idea when they listen, is this something serious or not? And then the way to tell for sure is with the echocardiogram, where we actually can image the heart and see for sure what's going on. But that first listen with the primary vet is a good place to start, and if they hear something abnormal, definitely want to get that checked out. And then if they're not sure, you definitely want to get that checked out. There are some breeders that I've worked with that want all their puppies checked by a cardiologist before they go to homes. And that's the kind of best way to know for sure. But that initial check with your vet is a pretty good place to start.
Okay, thank you. And why is cardiac health important, but it's also overlooked? And how do you think that'll affect breeding programs, being that it's overlooked often?
Right. Yeah, so the big worry for, breeding dogs is that they might have, a heart birth defect. And depending on kind of exactly what it is, there may be a period where the dog seems totally fine on the outside and you just don't know. And then, if they're being used for breeding, they could be passing on that problem to, all sorts of dogs. And then, some of these birth defects can really shorten a dog's life, where dogs are, dropping dead suddenly at 1 year or 2 years of age. And that's long enough that maybe they've already bred and passed this on. But there's just a lot of devastated, owners and breeders with, that are losing dogs. And so that's the tricky part, is there may be a period where just to the owners looking on the outside, you don't know, but there is something seriously wrong.
Right. And we see that a lot in our breed. A lot of our favorite studs, they sire hundreds and thousands of pups, and they're dead at 5 years old. And it's just so many dogs now continuing to be bred, and we don't know if they have this disease, or I guess what would you call it? It is considered as a disease. Am I correct? Or what's the correct?
There's a couple different, heart diseases that the dogs could have that would be causing, kind of death at an early age. I haven't seen, a ton of your breed, so I don't know. But my guess is the things I have seen are stuff where there's narrowed regions in the heart, so the heart's having to work harder. We can talk more about that. Get there, but yeah. So that's the concern with these guys.
What made you focus on cardiology, and how long have you been doing this?
Yeah, so I knew I probably wanted to specialize in something. So, after school, I did do that year rotating internship where you kind of see everything again in more detail. And it was during that when, I was watching the echocardiograms that other people were doing that I really got kind of inspired. When you see an echocardiogram, you see the heart in real time working. You can measure the blood flow through it. you know, and unlike some of the other organs where you're, you know, if someone's imaging the kidney or something, it's just kind of sitting there. When you're looking at the heart, it's obviously moving and doing stuff. And even people that have never seen it before are like, oh, wow, you know, it's just really cool. So that, you know, made me want to specialize in cardiology. And the more I've done it, the more I love it. I finished my residency and got board certified in June of 06. So almost 20 years. It'll be 20 years in this coming June.
Oh man, congratulations.
Yeah, thank you. It's been a long time.
So what's some of the most common heart conditions you see with bull type breeds from American Bully, which we haven't seen a lot of? We're a pretty new breed, but we come from breeds like the Staffordshire, the actual Bulldog, and also the Pit Bull. So if you can speak to any of those other breeds and what's common there.
Yeah, sure. So there's kind of two kind of general categories. So there's the birth defect issue that we're, you know, kind of most worry about as breeders, but then there's also diseases that animals get. Even if they start off totally normal, any dog as it ages can get different heart problems. So as far as the birth defects, when you look at the kind of breeds that kind of started your lineage, they get problems where the blood leaves the heart, that area of the heart muscle is narrowed. So that can either happen on the left side of the heart that pumps out the blood to the rest of your body, or the right side of the heart where the blood gets pumped out to the lungs. And there'll be an area that the blood has to flow through that's too narrow. And just like putting your thumb over a garden hose, the blood's going to squirt out of that narrowed region faster than normal. And that's how we can tell by listening that there's a heart murmur. But then that also puts a lot of extra work on the heart. So imagine you're trying to force the blood. Instead of a normal opening, there's this tiny opening that you're trying to just shove the blood through. And that just makes the heart work harder and harder. And that sets you up for, you know, arrhythmias, fainting, sudden death. So those are the main birth defects. So when that happens on the left side of the heart, it's called subaortic stenosis. And when it happens on the right side of the heart, it's called pulmonic stenosis. And it's the same general idea. That's just that you've got a narrowed region of the heart. And I've seen both of those problems in those kind of breeds that were the kind of where your breed came from. Now, as dogs get older, then you get into a whole different set of issues where dogs can get leaky heart valves. Dogs can get a problem called dilated cardiomyopathy, where the heart muscle gets weak. The bully breeds, or especially the bulldogs, are one of the breeds that I'll see heart tumors in. So there's all sorts of other stuff they can get, as they get older. Usually that's like, you know, 7+ years that other stuff starts to show up. But yeah, I'm assuming for you guys, you're most worried about the kind of birth defect stuff.
Yeah, the birth defects, the things that, you know, I say once we see that this dog should be removed from the gene pool, and we should no longer be breeding that, you know, that's kind of what we're focusing on. But speaking of, the next question is, how much of heart diseases in these dogs can be attributed to genetics versus environmental, if we can even create environmental heart issues?
Right. Yeah. So when you look at it like at the big picture, sort of like all breeds and like what I'm seeing day to day, you know, in general, like heart birth defects are rare. That's maybe like 5-10% of what you see. And all the other stuff is stuff that shows up when the dogs are older. Now, when you've got a new breed like this, and, birth defects are part of the problem. In your particular breed, that may be more of what you're seeing. But yeah, if you look at the population as a whole, you know, once people have kind of gone through the kind of breeding screening and made the changes to the breeding program like you're talking about, and things get, you know, kind of cleaned up, so to speak, you can get to where, most dogs are born totally fine. Now, there probably are some environmental things too, you know, probably diet is the main one. So we've seen some problems where if animals are on a very restricted diet because of allergies or something like that, that they can get nutritional deficiencies and problems with their heart muscles because of that. Just in general, dogs being overweight is not good for them. But yeah, those are the things that the kind of environmental things that we can control.
And if you have an environmental, issue going on with the heart, you don't necessarily need to remove that dog from your gene pool, or
right. Yeah. So if you had a dog that was, say, 6 or 7 and got like a leaky heart valve, that's really common as dogs age, that I wouldn't necessarily remove from a gene pool. No. When you're talking about heart screening to make breeding decisions, you're just looking for, does this dog have a birth defect? You know, that type of thing.
Yeah. Yes. Okay, thank you. Next question is, how early can a breeder screen a pup or a stud that they plan to keep in their program? When do you recommend they begin that?
Yeah, so there's a couple steps to that. The first, like we were already talking about, was just listening to them when they're puppies. I would definitely do that at the very least before you place them anywhere. Now, it's really common in all different breeds that little puppies will have heart murmurs when they're first born, that can get softer and then go away. All the heart murmurs we put on a loudness scale of 1 to 6, where 6 is the high end. And these sort of innocent murmurs, the puppy murmur should be in the 1 to 2 range, so pretty soft. So if people hear that, there's still some chance that the dog's normal. If possible, if I had a pup like that, I would hang on to it a bit longer. Most of the innocent murmurs are going to go away, or the ones that are going to go away would be gone by the time the dog's like 4 months old. So it's a little tricky because a lot of dogs will have been placed in that sort of time frame. But if you had a dog that was like 7 weeks and it had a murmur, maybe hang on to it a little bit longer and see if that's kind of getting softer or not. Once dogs hit a year, that's when you can do the full OFA certification for breeding. So for any breeding dog, somewhere in the 12 to 18 months sort of time frame, I would do a full echo, get them OFA cleared. Now, before that, if you had a dog that was, say, 6, 7 months old and had an obvious loud murmur, so like, a 3 or more, I wouldn't wait for it to get to a year. I would I'll echo it sooner. You're not going to get your OFA certification, but you're going to see what's going on, because that could be something that's serious that you want to learn about sooner.
And it's not on the page for me to ask, but being that we're on the topic, I want to ask about a murmur. Once you hear a murmur, the word itself has negative connotation, and people tend to say, hey, your dog throws murmurs. Now, I've been telling people that having a murmur is not necessarily a bad thing. It's an indicator that you need to look further into it. Am I right in saying that?
Yeah. So in general, the louder the murmur is on that scale, the more likely that it's something serious. But there's plenty of dogs that have soft heart murmurs, in that 1 to 2 range, that are not a big deal at all. And we'll see that some breeds like Goldens, Boxers, there are some of these athletic breed dogs. And then some of the like Staffordshire Terriers, a lot of those have murmurs. So, some of these dogs, a lot of them do have murmurs, and that that just makes it hard to tell just by listening. You know what I mean? And so if like half the dogs you listen to have murmurs, you really got to echo them to see for sure what's going on. There's some other breeds like, like a Pomeranian, say, where like none of those really, once they're adults, should have innocent murmurs. And so for them, just listening is a fairly good test. But for breeds where a lot of them have murmurs when they're young, it means, unfortunately, you got to echo a lot of them.
Okay. And we're going to move on to some questions about testing and prevention. What's the difference between a basic vet check, a cardiac auscultation, and an echocardiogram?
Yeah. So the auscultation is just listening to the heart. And again, that's something that your vet's going to do, a cardiologist is going to do. But again, the things that are kind of more quiet or trickier, the cardiologist is going to be better at picking up. And then we're also going to have a better idea when we listen, like our guess is if this is serious or not. We just have had more practice at that. And then even for me, like if I want to know for sure what's going on with a dog's heart, I'm going to do the echocardiogram. And that's when we get the ultrasound of the heart, you measure it exactly, you map out all the blood flow, and then there's no question about it. You know for sure what's going on once you've done that. But obviously that takes like specialized equipment, specialized training. So it's a lot more involved than just listening to them.
So I've heard people say, hey, if I have to get my puppy tested at 8 weeks and then I have to do it again at 12 weeks, it's pointless. I mean, at 12 months, it's pointless. And then maybe I have to do it again and again. So the question is, how often should you cardiac test your dogs?
Right. So for the birth defect end of things, like once you hit that 12 to 18 months and you've gotten your OFA echo, you're done. You don't need to keep doing that. Now, if down the road the dog gets symptoms or something changes with how they sound, so this is like that 6, 7+ years of age, because you can start off normal and get some completely, not one of the birth defects. You can get some age-related change or something like that down the road. But yeah, as far as the breeding issues go, once you've done that first OFA screen, either the kind of official one at 12 to 18 months, you're good.
Okay. And what are some warning signs owners and breeders should look for in dogs that may have heart issues, if there even are warning signs?
Yeah, a lot of times, like if a dog has a pretty serious birth defects, a lot of times they're the runt of the litter and they're kind of growing slow compared to the other dogs. They might have kind of exercise intolerance where they're just not playing as much or not as active as the other dogs. Sometimes animals will have birth defects in other areas of the body too. So if you see a dog that's, already got, say, like a neurologic birth defect or an orthopedic birth defect, I'd be really suspicious, if that dog's acting a little off, that you check its heart, because sometimes birth defects kind of come in groups. Now, as dogs age and we're worried about the more of the acquired heart disease, that's going to also potentially cause like exercise intolerance, breathing difficulty, dizziness, fainting. Those are all the signs that, maybe an older dog has a significant heart problem.
And can a dog pass a heart test early in life and still develop a serious issue later that you should probably remove the dog from your breeding program?
The biggest thing there, so most of the birth defects, you're going to know for sure kind of if the dog has it or not and what the severity level of it is. There is one that's a little tricky, which is the one called subaortic stenosis that I mentioned, where the blood leaving the left side of the heart, that area is narrowed. That can get worse as the dogs reach full adult size. So that may be one, if say you echoed a dog at 3 months for some reason and you were kind of right on the edge of having that problem, that could progress. Or if it was mild, it might get more serious down the road. But there's really only that one birth defect that does that. All the other ones, you can say for sure kind of what the severity level is going to be kind of whenever you image it. Now, like you asked about before, if you have a dog that its heart checks out totally fine, when it's a year, and then when it's 7 years old, it gets like a leaky heart valve from age, you don't need to pull that from your breeding program.
So once we hit a year and we do that full kind of that OFA style echocardiogram, and we pass that, we're pretty much in the clear.
Yeah. There's other heart problems that might show up as the dog gets older, but that's got nothing to do with like the breeding or the birth defects or anything like that.
Okay, good. And well, I know you're here in Virginia, and we can find you at Blue Ridge. What about other places? How would I guess the viewers go about finding a legitimate veterinary cardiologist in their area?
Yeah, so there's a website called veterinaryspecialist.com. If you look that up, you can put in kind of what you're looking for. So you just put in cardiologist and where you live, and it'll show you where all the cardiologists are. So what you'll see after our name, DVM or VMD or the abbreviations for being a veterinarian, depending on where you went to school. And then for the cardiologist, it's DACVIM-cardiology. That means Diploma American College of Veterinary Internal Medicine. So you should see that after their name. But if you look at that veterinaryspecialist.com, you can just search for cardiologist there. The other thing you can do if you're looking for clinics is you go to the OFA website. So the Orthopedic Foundation for Animals, OFA, they're the ones that maintain the cardiac registry. They started doing the orthopedic registry, so that's why they have that name, but they do all the different kind of breeding certifications. And they'll have a list of health clinics, so you can look in your area and see if there's any upcoming health clinics, and that should list who the doctor is there too.
Okay. Thank you. And we touched on this a little bit, but if you have more to add to it, how should breeders approach dogs that carry mild murmurs, and are murmurs inherently a bad thing? We kind of touched on it a little bit.
Yeah, so not necessarily, definitely if you've got a dog that you're potentially going to use for breeding, a honestly, I would just say echo them, kind of no matter what, but certainly if they have a murmur, you want to echo them and see what's going on. And there are plenty of dogs out there that have soft heart murmurs that still get an echo kind of clearance for OFA, but you definitely need to echo them to see for sure. Just because the murmur's there doesn't necessarily mean it's a problem. Again, once you start to get to that 3 or louder on the scale of the murmur loudness, it's more likely that it's a significant problem. But if you got a dog with a 1 or a 2, there's some chance that that's going to be innocent.
All right. And are there DNA markers or genetic tests that breeders can use today for early detection or prevention?
Yeah, that's a good question. So that's pretty new on the veterinary side. And actually, most of the genetic testing work is done at one specific veterinary school, the North Carolina State Vet School. So if you look up NC State like vet genetics, that will get you their lab. And they're always kind of adding new tests and stuff. I looked it up yesterday and kind of prep for this. I didn't see anything that applied to you guys yet, but that's the place that you would check. They're always coming up with new genetic tests. It just takes a ton of work to figure it out, but they've been kind of growing their test options over time. So just every now and then check that out, see if there's any new tests. And sometimes they'll do studies. They'll work with breed clubs and stuff to try to develop a new genetic test for a problem. So always keep your eye on them and see if there's any new studies going on or new tests coming out.
And you said that's North Carolina State?
Yep.
The Wolfpack, the NC State University?
Yep.
Okay, and we talked about something before we started the live. If you don't mind, if you can mention that again for everyone. You were talking about the sheik.
The which one?
The OFA, the sheik, or the CH.
Oh yeah. So Canine Health Initiative. Yeah. So if you go to OFA, OFA.org, and then they'll have a tab up at the top where it says browse, search by breed or recommended tests by breed. And that'll tell you for all the different breeds, what are the kind of tests recommended for the breeding dogs. And when I looked you guys up the other day, it was the echo and then hip and elbow x-rays. But yeah, keep your eye on that. That's a good place to start. Canine Health Initiative, Chick. And yeah, it's on the OFA website up at the top. You can find it there.
How can breeders balance drive for structure and look with long-term functional heart health?
Yeah, that's a tough one. So kind of whenever you pick one thing and like hyper focus on that to the exclusion of everything else, you can get yourself in trouble. Because you end up with such a bottleneck in the kind of breeding program that you just a small number of dogs, and then stuff can get in there and get passed on. So ideally what you would want is you want to find dogs that are either, for you guys, ideally would have the body shape you want and are heart normal. If you can't find that, then what you'd have to do is like, how close can you get to the ideal body shape and still be heart normal? Because the body shape you can maybe adjust, moving forward. But if you're starting off with serious heart problems, you're just never going to get anywhere, because you're going to be losing dogs all the time, and people aren't going to want to get into the breed if, they're having dogs drop dead suddenly. So find the dogs that are like closest to how you want to look, but, still have a normal heart. And again, they might have a murmur. It's all about what you measure on the inside,
Mm-hmm. Okay, so what's your take on the idea of hybrid vigor, and can outcrossing improve heart health?
Yeah, for sure. Like we were just saying, the kind of the more narrow your kind of breeding pool is, the more likely you are to kind of get different problems, not just heart problems, any sort of different birth defects. So yeah, the more you can sort of outcross and bring in new dogs, assuming they're heart clear, you want to make sure you got healthy dogs. But yeah, that can definitely help to broaden out that gene pool a bit.
What are some of the biggest mistakes owners make when dealing with dogs with trickier builds? How our bullies are, we're pretty massive, and we got a lot of muscle and bone density. So what's some mistakes that we make?
Yeah. So there's a couple different things, there's the, kind of orthopedic end of it where dogs can have problems with their joints and spine and stuff like that. But what I see more of, kind of heart and lung problems or airway problems. So any of those dogs with the kind of shorter face, like the bulldogs, like an English bulldog, say, especially ones that are really kind of big and muscular, they can have problems where their airway's too narrow, kind of anywhere from their nose all the way down their trachea, and they can get into real serious kind of what we call an upper airway obstruction, where they basically just, can't get enough kind of air in. And that can get much worse when it's super hot out, So these types of dogs, especially if you've got a dog that's got real noisy breathing all the time, and you got to be super, super careful in the heat with those dogs. That's another reason dogs can't even just die suddenly, either from like heat stroke or a worsening airway obstruction. Those things tend to go together. The hotter the dogs get and the more they pant, the worse the airway problem goes. And then that also drives their body temperature up. So that can be a real serious emergency in those really kind of big dogs, especially big dogs with shorter faces.
Yeah, we see that a lot. Unfortunately, dogs dropping dead or just seem like they having a hard time in those, hot weather.
Yeah, for sure. Yeah, that's a real common emergency that, in any of those types of breeds that, people just overdo it in the summer.
Overheating. And how much does diet, weight, and exercise affect the cardiac performance and lifespan?
Yeah, we don't have as much information about that as they do on the human side, but there have been the one in particular, one really good study. It's kind of common sense that like the heavier the dog is and the more kind of garbage its diet is, that might impact its lifespan, But there was one study looking at Labrador retrievers where they actually, for the dog's entire lifespan, they had one group that kind of ate a normal amount, and then they had another group that they reduced it a little bit. And as you imagine, the dogs that ate a little bit less, they were leaner, but they also lived like on average almost 2 years longer than the other dogs. And stuff like the hip dysplasia, arthritis, and problems like that was less likely to show up. And when it did, it showed up later. So in general, keeping your dog, you don't want it sickly thin, but on the lean side, and you definitely want to keep up with regular exercise, keep them fit. I think that stuff can make a big difference.
Okay, that's good. We tend to like to have our dogs more on the massive side and to look as bully as possible. So that's good information. For dogs that are diagnosed with mild cardiac disease, what kind of maintenance or supplements truly make a difference, and what's really just hype?
Yeah, it would depend on kind of the exact heart disease that they have, but some general guidelines would be to avoid like big changes in salt intake. So some of the dog like pepperoni and sausage snacks and just like processed real salty food, if you could, I would avoid that if a dog had heart disease, especially like if you have a dog with more serious heart disease and all of a sudden it just eats like a big ton of salty food can cause fluid retention. And if you had really bad heart disease, that could be enough to actually cause problems for you. So we try to, like, once we know a dog has heart disease, start to clean up the diet with the kind of processed salty stuff. Now, as far as different supplements, depending on what dogs have, with some heart muscle diseases, people might add things like taurine or carnitine. If you've got a particular problem where your heart muscle is too weak, probably the supplement that gets used the most are fish oil supplements. Those that have some potential benefit for the heart, in addition to things like your joints and skin and stuff like that. So that's probably the supplement that gets used the most.
Is that just a omega-3 thing?
Yeah. And you want to do one that's dog specific. Sometimes the human ones have, could have flavoring agents in it that are bad for dogs, or different vitamins that are the wrong dose for dogs. So just make sure to get one that's for dogs.
All right. Now I want to get into some myth busting things right now and see if we can just talk a little bit real about some of these issues. Some breeders say bullies just breathe heavy, quote unquote. How do you separate what's normal versus an actual red flag?
Right. Yeah. So kind of like we mentioned before, one issue is that kind of airway obstruction stuff. So there are some breeds where, their kind of normal breathing is a bit loud and kind of snory sounding. And then it's just sort of a judgment call of kind of how extreme is that getting. And is it causing problems? Does the dog try to like jog across the room and then all of a sudden has this real noisy breathing and can't keep going and seems kind of dizzy, or it's like gums are turning blue? Those are all signs that no, that's not just kind of regular breathing noise. That's an actual, what we call an airway obstruction, where they're just not getting in enough air. When dogs are breathing fast from heart disease, that's all the time. So even when they're sleeping. And so that's a good time to watch your dog's breathing, is when it's just laying there doing nothing and ideally fast asleep. And if it's breathing fast, then odds are there's something wrong.
Okay. And here's another one that we hear a lot in this community. And I want you to speak to this as honest as you possibly can. What's your response to people who say heart testing is just a money grab?
Well, I mean, the truth is, it does cost more than some other tests. The echocardiogram machine's expensive, and you have to have, kind of specialized training to do it. That said, if you find, the cardiologists that are doing breeding clinics, like when we go to a dog show and, echo a bunch of dogs, depending on kind of what we've worked out with the club and whatnot, that's probably anywhere between like a 50 and 75% discount that we're giving people, because yeah, we know the breeders, it's an extra cost for them, and they're trying to do the right thing and get these dogs screened. So, the cardiologists that want to be part of this, we do those things at like a heavy discount to try to make it more affordable for people. And then the other thing too is, prospective owners, especially if they're going to get dogs that they're going to think about using for breeding, they're going to want this testing done. And so you can factor that into the cost of your puppies. And, I think it's worth it for everybody to get the test done and see for sure what's going on.
All right. And how can our bully community work together to raise the standard of health testing without us having an ego involved?
Yeah, I mean, I've worked with a lot of different breeds, kind of over the years, and you'll kind of go through this cycle where there'll be kind of almost like rumors, like, oh, hey, this breed has this problem, but then everyone's really quiet about it. Nobody's talking about it. Dogs are dying and no one's figuring out why. But eventually the owners come together, breed clubs come together, and they're like, no, we're sick of this. Like, we're going to share information. We're going to talk to each other. We're going to get the testing done. And then, it comes together real fast once people actually start doing it. Each generation that you do that, the kind of incidents, the numbers of dogs with the problems goes down and down. And so, it definitely works. Now in the beginning, it's hard because people don't want to talk about it. There's dogs that you love the way they look, and you're going to have to pull them from your breeding program, and people don't want to do that, but it's worth it. It's worth it in the end. You do that for a few generations and problem solved almost,
Right. And to everybody in the comments with questions, we're going to save the questions until till the end. You'll have an opportunity to ask Dr. Weidman all the questions you need within, a good amount of time. So we're going to just keep moving forward. I'm not ignoring you. I just want to stay on course. Okay. So actually, we're moving into closing thoughts now, and then we'll open it up. But one of the closing thoughts I have for you, if you could give breeders one non-negotiable piece of advice about heart health, what would it be?
Yeah, I mean, I guess it's kind of like we were just talking about, is like, make the hard choices, to get the echoes done, see what's going on, get the information. You know what I mean? You until you look, you do not know what's going on, and when you start doing the testing, get the information, share the information. It makes a huge difference, so just don't stick your head in the sand over heart disease. It doesn't go away if you don't do anything.
And what's one misconception you wish more people understood about canine cardiology?
Yeah, on a larger scale, it's probably a similar thing in the sense of like, just don't wait. Sometimes people will, go to the vet and they'll know their dog has a heart murmur. Say a dog's 7, 8 years old or something. It didn't have a heart murmur when it was younger, and now it does. There's going to be a period where they seem totally normal on the outside. And sometimes people get kind of complacent during that phase and just kind of blow it off. And then eventually it does get more serious and can be a big problem. So, if you definitely just want to get things checked out, I guess I would say, the sooner you know what you're dealing with, the easier it is to manage. Or sometimes you're like, oh, this is mild, we don't need to do anything. But at least now versus if you sit on it until it's an emergency, then it just gets so much harder to deal with.
Understood. And how can breeders collaborate with vets to make cardiac testing more common and accessible in our bully breed? We're new, within 30 years, we're emerging. So, what can we do to work with the vets?
Yeah. So I would, start by looking at that vet specialist website, find the cardiologist in your area, and just reach out and say, hey, do you guys do, breeding clinics? Either at some places will do that, like at their hospital where people, kind of drive to them, and then the breed clubs work together. We'll do that sometimes on a weekend. People all show up and, do 40 dogs. And then other cardiologists will kind of go to you. So if you've got a big breed show coming up or a club meeting, talk to the cardiologist in your area and say, hey, can you guys come out and, kind of set up especially if you guys have other breed events going on, just people will kind of cycle in and get the testing done while they're there. A lot of us, want to help out. So just reach out to the cardiologist in your area and see what they can set up for you.
All right. So can you mention that website again?
Yeah. vetspecialist.com.
Okay.
Yeah. So you can search by cardiologist there. But yeah, definitely, the breed that have had like the real active breed clubs, like, in our area, like Doberman Pinschers, there's like a couple of different clubs and they kind of set up all these testing. And once it gets rolling, then you've just kind of got to get set on your calendar. Like, I've got Doberman Pinscher clubs where a couple times a year I go out and, kind of do all the testing for them. So,
all right. So that pretty much, wraps it up with the questions that I had for you. Do you have anything that you want to say that maybe I missed before I open it up for questions?
No, I mean, I think that's a pretty good kind of list of stuff we've talked about. Yeah, again, if people start off by just looking up the specialists in their area, kind of go from there, reach out to people. Yeah, definitely get things set up.
And if you are in Virginia, I recommend you hit up this guy right here. I've been to him at his office, and he's also come to my home both times. Great experience, totally professional and fast. I appreciate, time. So, he knock it out fast. If you're in Virginia, please get in contact with Dr. Weidman. And now, if y'all have questions, now's the time. I was not ignoring you all. So, whatever you have for Dr. Weidman that we didn't discuss, let's do it now. And if you have some things specific to your program and what you want to know, you drop the questions in. I'm going to bring it on the screen, and Dr. Weidman is going to answer those. So let's get them going. I'll go back a little bit and see some of the questions I may have overlooked earlier, and then I'm going to move to what's current. Somebody wanted to know, we touched on this a little bit, so hopefully I answered this. Dr. Weidman answered the question, but I'll bring it on the screen just in case. It says, does proper exercise conditioning help any of these issues?
Yeah, so you're not going to change if a birth defect is present or not, with that. But, in general, the stuff that dogs get when they're older, yeah, it's going to make a difference. Keep them good weight, keep them up with regular exercise. And if they get a heart problem, as long as we're not pushing them too hard, some exercise is still probably recommended for them. It'll depend on exactly what they've got going on. So once an animal has heart disease, follow your vet's recommendations there. But yeah, in general, yeah, keep your dogs at a good weight and keep them with regular exercise.
Okay. Does climate change affect heart issues?
The biggest, not so much with the heart. Like we were talking about the upper airway obstruction, that part definitely gets worse when it's hot. Dogs with heart disease, I guess the hot weather is not going to cause heart problems, but if you already have heart problems and then you're out in the hot weather, that does make it hard for you. So depending on exactly what a dog has going on with their heart, we might set some restrictions, both for like how much exercise do we want them to do and what should you do when it's really hot out. We might make some restrictions there.
What is a benign congenital murmur, and is it something that should be ruled out for breeding?
Yeah, so there are dogs that have benign murmurs. The congenital part, that's a little tricky. That means it was like passed on. You don't know that for sure. You could just say it's present when they're young. So yeah, if you have a young dog with a heart murmur, especially a dog that you want to breed, you should echo it. And you may see that, hey, yeah, this is innocent, and we don't need to worry about it. That's the best case scenario. But yeah, you got a young dog with a murmur, get it checked out.
So it sounds a little tricky. Benign and congenital together. Is it kind of hard to say if you should or shouldn't breed that?
Well, it would depend on exactly what we got with the echo findings. So, as I talked about earlier, so the most common problem that we'll see in these dogs is that these areas of their heart are too narrow. And the smaller it gets, the faster the blood squirts through the heart. Again, just think about like putting your thumb over a garden hose. So we have normal numbers for when you measure the speed of blood flow through the heart. What should it be? And the faster that number gets, the more we're like, hey, this might be a problem. And then you kind of hit a certain cutoff number where you're like, no, this definitely is a problem. And so it's going to depend on that exact speed that you get. But so it's possible you can have a dog that's had a murmur since it was born, stays there its whole life. But when you check the flow speed, it's close enough that you'd say, you know what, that's normal. We don't need to worry about it. On the other hand, if it's past a certain number, we would say, hey, don't.
If that's the wording on their OFA, is that incorrect? And the wording that she's referring to is benign congenital murmur.
Let me see.
I guess what she's trying to find out is
Normal.
a dog that has that exact wording, benign.
Yeah, that's odd. I wonder, because I just pulled out like one of the old reports. So ideally what you should get is we check a box that says normal, no evidence for congenital heart disease. That's what you want to see checked off. If later someone also wrote on there normal or benign congenital murmur, that'd be a little weird. I wouldn't write that. That's just a little confusing. You want the thing that says no evidence for congenital heart disease checked.
And she also said, would that be results of auscultation?
Maybe
what is an auscultation? Can you tell us?
Yeah, that's just the fancy name for listening to their heart. Okay. So it could be, you could listen to them and say, my guess is that this is a benign murmur. I personally wouldn't throw in the word congenital if I thought it was innocent, because it just, as you can tell, we're kind of confused to what exactly that means. But ask someone to clarify it. If that showed up on something, just say, hey, what do you mean? Is this normal? Can I breed this dog? What was the exact flow speed? Like, do I need to be worried about this or not?
Okay. And so this question was about to the climate change. It says, is humidity, I believe, is humidity the monster and not heat?
They're both problems, yeah. So high heat, high humidity, either one can cause a problem, yeah. Yeah, when you get them both together, it's even worse, yeah.
It says, thank you. I wasn't sure if it was a real test or not. You never know these days. So yeah, she's just saying thank you for answering.
Yeah, and I guess like if you want a good kind of litmus test, if you're not sure if someone did the test or not, or what they're saying, just say, hey, what was the blood flow velocity? What was, and if they don't have a number for you, then they probably didn't actually do, or it's just not
it's hard to get that information, especially if you're dealing with some of these stud owners. People are moving, I guess, in secrecy, and they may give you this and says, hey, this is the result. But, they really don't want questions. They don't want to talk about testing. They're making so much money already by breeding these dogs, by not doing these things. When you ask them to change up, it could only cause them to possibly lose. So
in the short term, maybe, but in the long term, once they have the dogs that like look the way people want and are healthy, everyone's, so.
But nobody is moving. Well, I can't say nobody. Not enough people are moving toward heart testing right now because they stand to lose. financially.
No, it's hard. It's hard. But like I said, I've seen different breeds go through this, and they come out stronger on the other side. It's tough at first, but it's worth it.
Well, I don't see any more questions coming through. I'm gonna give you guys a couple more minutes, and if no questions are coming through, Dr. Weidman has answered a ton of questions and has given us a lot of just great feedback for our breed and heart health moving forward. So just a few more minutes, man. If y'all have any questions, please do, because I may have touched some things that were important to me, but if you have something that's important to you and your breed program, man, don't be afraid to, ask that question right now. I encourage you to. And yes, we can have both. We can have good looking dogs and healthy hearts. I agree.
For sure. Yeah.
Thank you for your time and the information. Since I really appreciate it. Someone else says, thank you for your time and knowledge, doctor. Someone says, what's the next event he's attending? We are in Virginia. So you're in Georgia, right? But they want to know the next event you're attending.
There's one at Eagles Nest Veterinary Hospital in King George. That's in like the spring. That should be on the OFA clinic's website if you look there. But yeah, for people in Georgia, reach out to the vet school. I bet you could try to set something up with them.
Should I'm not sure I understand this question. Does this make sense to you, doctor? Should bullies walk around with a 5 o'clock shadow rib cage? I don't understand that question.
Yeah, I guess what we say for in general, if they're asking about like kind of an ideal weight, we say that you want to be able to easily feel the ribs but not see them. So that's a kind of good, just for all breeds. You should, if you run your hands on their chest, you should be able to feel where their ribs are without having to really shove. But you don't want to, if you can see their ribs from across the room, they're too thin.
How does the general consensus of vets feel about breeding?
Well,
do y'all like us? Do y'all like us?
That's where dogs come from, right? So it really just depends. It's like, unfortunately, there are the horror stories of breeders who kind of do everything wrong and get these dogs that are a mess, and kind of poor families get hit with that. And it's a heartbreak, when you see the young dogs that, families already gotten attached to, and they're really sick and the animals die. I mean, that is just devastating. On the other hand, like, there's great breeders out there that do all the testing, keep all the data, they've got great lines, they share their information with everybody. They've been sort of ambassadors for the breed. I've seen breeders that have just taken so much on to do all this extra work. And it shows, so just like anything else, there's good ones and bad ones, but the people who do it right, they're putting in a ton of effort, and it shows. And I'm happy to work with them. I'll go to, breeders' facilities, help them out, scan their dogs. It's like when you can tell people are doing the work, like, you want to help them out.
That's true, for sure. I can vouch. We just have a lot of people that are saying thank you for your time. They're saying that this is a great live. He said he's in Georgia, but he said he will hit the road.
Yeah, look at that OFA. Like, there's a lot of clinics out there. You can find, places in your area you can go to.
Games has been preaching about this. Ray, thanks for organizing this. It's just something that I started to care about recently, but I guess you're welcome, but thank you to Dr. Weidman for taking the time out of his day on a work day. And I'm pretty sure he's coming up on lunch, and he decided to do this. He did not have to. I know he's very, very busy. So organizing this is no problem for me. I have a passion for it. So, I've been wanting to do it for a while, and I'm just glad we found some time to do it. So no thanks to me, man. All the thanks to Dr. Weidman. But
glad to help out.
He says that Chuckle said a lot when he asked, "Hey, how do vets feel about us?" Most of us, I'm not gonna lie, most of us in our community, we really don't like the primary vets. We tend to try to find vets that specialize in the breeding, and the ones that's not going to say, well, maybe you should fix this dog. So we kind of, we talk amongst each other and try to find good vets that respect us. And here's okay, we got another question coming in. So if a dog snores in his sleep, is that concerning?
No, necessarily. No, a lot of dogs do that, but if they're having noisy breathing all the time, I would have somebody check it out. But yeah, a lot of dogs snore in their sleep.
How quickly can you hope to see results in the breed as a whole? Like I said, we're new. We're like probably 30 years in.
I mean, even in a few generations, you can start to be moving in the right direction. You know what I mean? So, I mean, dogs can breed pretty fast. So yeah, 5-10 years. Yeah, you could definitely see a big change in that. Like, for example, it's a separate issue, but, the dogs, how I mentioned some dogs, when they age, they get leaky heart valves. And in most breeds, that's, 7, 8 plus. Kind of one of the exceptions is the Cavalier King Charles Spaniel. It's a smaller breed dog, but some of those can have leaky heart valves showing up, as soon as like 2 or 3, and that can really cut their lifespan short. But when I first came to Richmond, is where I started before I came to Charlottesville, we would see these Cavaliers and you'd listen to them, and so many of them had murmurs, but the breeders were doing the right things and pulling the dogs. And like 10 years into doing that, those clinics and breeders making the calls, like I would see Cavaliers, some of them like 12, 13 years old and still don't have heart murmurs. And that was like unheard of when I first started. So like it already made, in my professional career, made a huge difference locally in the breeders doing the right thing. So yeah, it'll work. Yeah. I think 5-10 years, you could see a massive difference in what's out there.
Post your Zelle, lunch on me. That's to you. That's to you, Doc.
That's all right. I've already got lunch. Thank you very much. I'm glad to help.
All right. I don't see any more questions coming in, and I don't want to hold Dr. Weidman any longer. I appreciate you for jumping on here, Doc.
Yeah.
However you would like to close out, the floor is yours.
No, thanks for having me. I'm always glad to help out. And yeah, if breed clubs, if you're getting together and want to try to set up a show or something, clinic, just reach out. We can set something up.
All right, man. I am DCB Ray. This is Ped Talk, and we are closing it out with Dr. Weidman, Heart Health. This will be online. This will be on my channel, Different Cloth Bullies, and this will also be on YouTube. I will leave this up for a future educational video. Y'all have a good morning and enjoy the rest of your day. And I am going to leave y'all with this, and we are out.
Gino and Fino. He know it's Fino. It's Gino and Fino. It's that pet talk.